I asked several doctors, "What's your favorite natural remedy?" We asked doctors from different specialties the same question. What's a natural remedy you genuinely trust? The answers surprised us. Here at Dr. Smart Natural Medicine, we've gathered everything they told us, specialty by specialty. Stick around until the end, because a couple of these tricks you've probably never heard of. Let's start with a pediatric tip. Sugar can help stop hiccups, especially in babies. That said, not before 1 year of age in very young infants. There's a risk of a bacteria linked to infant botulism. But after the first year, a little dissolved sugar works just as well, or even better, than many hiccup stopping tricks. It's simple, it's natural, and kids love it too. From dermatology comes white vinegar. Diluted with water, 1 part vinegar to 3 parts water. It has antimicrobial and antifungal properties. It can be used to clean minor wounds, fight athlete's foot, or even help with dandruff. A pantry staple that many don't realize is also a skin ally. An anesthesiologist shared a curious trick. After surgery, many patients feel intense nausea, and simply holding an alcohol swab under the nose can relieve it almost as well as medication. The principle is called olfactory distraction. The smell is so strong that the brain gets distracted from the sensation of nausea. The effect can last up to half an hour and also works for morning sickness during pregnancy. From gastroenterology, the star remedy is ginger. It's backed by extensive research and provides real relief for chemotherapy patients, pregnant women, and everyday nausea. Unlike some medications, it doesn't come with side effects like irregular heartbeat or constipation. A UK emergency medicine doctor was up front. For true emergencies, the hospital is always the right call. But for non-urgent situations, he recommends warm olive oil to soften built-up earwax. And if you ever get a ring stuck on your finger, look up the ring removal string method online. It's a simple technique emergency doctors use all the time instead of cutting the ring off. A pediatric emergency doctor opened with a joke. My favorite natural remedy is penicillin, because it comes from a fungus. Joke aside, he shared his real go-tos. Lemon and ginger for nausea, salt water gargles, and a honey and propolis mix for sore throats and canker sores in kids. All of them, he said, he uses with his own family. From OB-GYN comes a remedy with solid scientific backing. Cranberry juice or extract to reduce the risk of recurrent urinary tract infections. The active ingredient, proanthocyanidin, prevents certain bacteria from sticking to the bladder wall. The recommendation is to look for supplements with at least 36 milligrams of proanthocyanidin, or 100% cranberry juice, taken daily. A podiatrist shared a very popular home remedy: menthol-based ointments. Their active ingredients have antifungal and antimicrobial properties that help penetrate the nail and slow the fungus down. She noted, though, that it needs to be used consistently, and no topical treatment alone guarantees a full cure. From plastic and reconstructive surgery, the favorite natural remedy is PRP, a concentration of platelets and growth factors drawn from the patient's own blood. It's used to boost healing, stimulate hair growth, and support facial rejuvenation alongside microneedling. and it's also widely used in sports medicine and orthopedics. Since it comes from the patient's own body, the risk of an allergic reaction is minimal. The procedure is minimally invasive, and recovery time is short. A sports and emergency medicine doctor revealed a classic: clove oil. It contains eugenol, a compound that temporarily numbs nerves and relieves dental pain. Just soak a cotton swab and apply it to the affected area. It's not a permanent fix, but it can hold the pain off until you can get to a dentist. Essential oils of lavender, peppermint, and chamomile were also recommended. Peppermint oil in particular is recognized in clinical guidelines for headache management. Menthol creates a warming sensation, activates certain receptors, and triggers mild vasodilation that reduces pain perception. Applied to the temples and the back of the neck, it's been linked to a noticeable drop in symptoms, while also promoting relaxation and reducing the need for stronger painkillers. A psychiatrist put it simply: there's a treatment that can boost mood, ease anxiety, improve sleep, and lower the long-term risk of dementia, and it's completely free. It's exercise, even in inflammatory conditions like rheumatoid arthritis, where it might seem logical to protect the joints by avoiding movement. The opposite is true. Physical activity reduces pain, anxiety, and inflammation, improves circulation, and preserves strength and flexibility. To wrap up, several specialists agreed on something we tend to underestimate: getting good sleep. Quality rest affects blood pressure, hormonal balance, and the production of neurotransmitters like dopamine. During sleep, growth hormones are released that help repair tissue, along with substances that strengthen the immune system. Good sleep, in fact, can reduce pain perception more than many supplements. So now you know. From sugar for hiccups to a good night's rest, nature and science often go hand in hand. If you enjoyed this roundup, hit like, subscribe, and turn on notifications for more real health content, explained by the people who practice it every day. This has been Dr. Smart Natural Medicine. See you in the next video.